This is Pamela Wersch from the Encourage Your Wellness podcast. And today I have Dr. Heather Tallman Ruhm. Thank you so much for being with us.
Thanks for having me. Pleasure to be here.
All right. So, doctor, you're a board certified family physician. You focus on whole body health and patient education. You have worked with a number of ages and a number of diagnoses, and would love to hear more about your journey and some of the things that you're really focused on right now.
Okay, wonderful. Yes, I'm a family physician by training. I was trained in a conventional Western style for medicine. I went to the University of New Mexico School of Medicine, and I always had an interest in kind of the whole person and nutrition, exercise, how to optimize health, for anybody of any age, really. And when I got through medical school, I loved medical school. It was a wonderful experience, learning about how the body works, the incredible magnitude of what our body can do at a cellular level, at a biochemical level, physiology, anatomy. It was just amazing to learn about how the body worked. And then transitioning into residency or into the clinical phase, it felt like we got a little bit more away from some of that, from what made the body so amazing and wonderful, and a little more in the direction of findings, diagnoses, and using codes for those diagnoses, and using kind of a prescription for those diagnoses, or a very more regimented approach to prevention that didn't leave a lot of room for, bioindividuality. And also it kind of strayed away from my original passion for nutrition and whole body health in a way. So that kind of longing for that part of medicine, even before I got into medicine, some will ask that why my crazy journey took me to a master's in public policy before I went into medicine. It's because I was interested in health, kind of global health, right, too. But that path kind of away from those roots of interest left a longing. And that longing started to be fulfilled early on when I went to work at the Whitaker Wellness Institute in California. And there it was kind of, full immersion, working in an environment where there was not an emphasis on drugs or surgery. And in fact, there was an emphasis on helping bodies heal from whatever ailments without the heavy use of drugs and surgery to get there. So really much more in line with the compatibility of using the natural capability of the human body to resolve issues with the right supports and by removing the obstacles from healing. So fast forward, I've worked at in quite a few different environments of integrative, holistic, bioregulatory, integrative, functional, whatever the popular word is today, for looking at the whole person, looking through the lens of bioindividuality, collaborating with practitioners from a very broad range of perspectives, modalities, so very transdisciplinary teams of individuals, be they teams in one environment like they were at the Whitaker Wellness Institute, or across a region or throughout town. But so I've both been in my own private practice where I hung my shingle and it's kind of the only show there, to right now I work at the New Hampshire Health and Wellness Center. And that's a collection, almost like a co-op, collection of practitioners that work in that same space of healing, using lots of different modalities, but working both independently and then cross-referring. You're probably learning about me more from a different line of work.
So what does that mean? So what types of people come to you? What are they trying to look for? What kind of tests do you like to run? What are you thinking as you're meeting with people?
All right. So that's a good question. And I think the answer is a lot of different. I don't really follow a particular protocol. I see patients as fairly young. I don't do typically primary care in the sense that I consider myself more adjunctive to somebody's primary care. So I'm no longer delivering babies or doing newborn checks and that kind of thing, or working on the other end, like in hospice or in the hospital setting. It's more people coming to me and coming to this practice who have all types of conditions, but are looking for a means of doing what they can to nurture their health in some way. So they may be getting conventional treatment someplace, and then want to look at, say, their nutrition and their lifestyle, or what might be underlying their condition that they haven't looked at yet. So they've gotten the idea of root cause, or what you think of as functional medicine. So I would say, if you look at our clinic in particular, it is primarily adult medicine, but I see children, I see all ages, and so do most of my colleagues. Maybe not all. So there are naturopaths, acupuncturists, hands-on Reiki, massage, craniosacral, doing sound therapy, a whole range of things. So as far as navigating what's best for a patient that walks through my office, it's really a lot of the history, looking for patterns in presentation, in illness, in interventions, and starting to sort out what comes up as like their priorities. So that might look like somebody has a heavy amount of inflammation. It may look like I may suspect a hidden infection. I may suspect that they could use something much more nuanced for their, like, say, genetic makeup. If I see certain things like in a family. And that isn't to say looking for a gross genetic anomaly. That is looking across what your listeners probably know of as SNPs, which are single nucleotide polymorphisms, or genomics, to see where they vary slightly from other people in society and where they might biohack, to use that term, their health based on their individuality. So the type of testing I don't usually rely on a lot of heavy testing up front. There are practitioners who do, and I respect that, and they're very good at the nuanced interpretation of those tests, because even if you take a standard lab test, which I will not infrequently order, maybe CBC, a complete blood count, a complete metabolic panel, thyroid tests, maybe certain vitamins, and knowing just enough to perhaps test it slightly differently. Like I might not look at magnesium. I wouldn't write on my requisition magnesium. I'd write red blood cell magnesium, because to me that's more clinically appropriate, or what's kind of explains to me what's happening in the tissue with magnesium, not just what's in the serum, or the plasma. So that's helpful to fine tune standard labs. Sometimes that's what's accessible for patients. If it's an insurance issue, or if it's a small child, sometimes collecting a lot of labs is very inconvenient. That isn't to say it can't be helpful. So it probably gets me into describing more the kind of work I'm doing with another organization that you're probably very familiar with, which is Epidemic Answers. And so my one hat is that I work in a clinic, which I have for many years, various clinics, and that's my own private practice. It's part-time. For the rest of the time, I am working with an organization called Epidemic Answers. It's a nonprofit that serves parents and practitioners with resources to help navigate chronic illness, or to keep their already healthy children healthy, or make them healthier. So that drew my attention many years ago when the director of that organization, Beth Lambert, wrote, I think, her first book, which was A Compromised Generation, looking into what is happening with our children today. And as I read her book, I said, "Oh, this is right in keeping with everything I've learned from a holistic functional approach and the various individuals I've been listening to over time, whether it was from A4M, which was one of the early, forms of kind of medical communities that looked at what was happening from a physiologic standpoint, from a total load standpoint, what's weighing on people's health today." To the more modern practitioners that really moved the biological approach to autism forward. So she was speaking about our children in the same way I was learning about what's helpful, what seems to be harmful, and really looking at that, what we call a total load perspective now. So her book, I think she wrote about 10 years ago, and I was always kind of an advisor in the wings, waiting for this kind of project to take place where they were developing the research capacity to study scientifically, what is it that's burdening our children globally? What are all the things, if we looked at all the total load on our children today, what things are most impactful? What things, are most impactful under certain conditions? What things are most impactful for children being healthy? And then, so they created a research project around that. And I was there to advise when time was appropriate, as well as a prospective study. So the first is, there are two studies. Do you mind me telling about it?
Oh, no, please. And I mean, frankly, the work done at Epidemic Answers has been life-changing in my family, because it's not just one thing that you have a symptom from. There's a bunch of things that pissed off your body, for lack of a better word. Okay. And now you've got to figure out how to calm it down. And you can't just calm it down with one thing. And so that's really the interesting thing about the work being done at Epidemic Answers, and the insight that has been done in the written works and the research, really explaining in layman's terms how this can impact this can impact this, and how all of it together then creates these massive diagnoses. So yes, please.
Right. The perfect storm, as it were, right, for your child and when you look at that kind of tip of the iceberg, which often comes to a parent in the form of a diagnosis that's completely overwhelming, right? But sometimes comes forth in different symptomatology. Then under that iceberg is, a lot of other things that maybe that the body, the physiology is trying to navigate under this sea of kind of total load. So that is extremely appealing to me, that we're not looking at a smoking gun as the source of all evil, right? It's like, what are all the things that are contributing today to the health of our children? So that has manifested in two research studies, two IRB-approved research studies, one being a broad survey, over 1,000 questions for parents to fill out if they have a child between the age of 1 and 15. That takes a deep dive into everything that they've either been exposed to, that's a current part of their life and their diet or their family or their history, and takes all of that into account, and then generates a report that shows from the literature what things, whether they had a C-section or whether they were breastfed and how long, just every detail about their house and where it's located and every detail you can imagine, and then starts to sort out which things rise to the top in different conditions. So that's been a really interesting part of the research. And the other research is a prospective study working with live children, not that the children aren't live for the CHIRP study, but children in real time, to take them from or follow their journey from kind of the onset or early stages of a chronic illness to 18-month course of time wherein someone or a collection of multidisciplinary team of individuals are working with that child to see progress toward recovery. So I came into play in a more active way a few years ago when the research moved into that dimension and they needed a medical director in the context of that, working as research people facilitating this process. We're not acting as the clinicians, but we're facilitating the work of a multidisciplinary team of clinicians supporting this child, and then the family's input and the family's contribution to the narrative about what's happening with their child. both from a lab standpoint, as various assessments and various both written assessments and then assessments from specialists, say somebody that understands reflexes, somebody that understands that the neurooptometry, that the brain and the eyeball are one and the same, and that you can study the innards of the brain through the eyeball. And then you can also work on healing that body through the eye, or, correcting vision in certain ways. So different groups that use their skill at understanding how something is functioning to see what's happening internally with that child as well, and then navigating that and improving it. So kind of in a summary, simplified way, I kind of think of it like Goldilocks medicine, right? Looking for just right. So as you look at the total load, you're saying what kind of things are weighing heavily, what kind of things are contributing to that stuck place of an individual or dysfunction. And then where is there not enough support? So how can we lower the load on the child and raise the supports, maybe very uniquely specific to them? And sometimes that requires some testing, or maybe a facility with interpreting body language, like you may look at someone's fingernails and see lots of white spots and think, oh, they probably have a zinc deficiency. So you can use that and employ things that are not offensive to the child, or use something more subtle like homeopathy or energy work of some sort to give you feedback, and then to offer some kind of guidance as to what might lower the load, what might raise the supports. And then where you see that something has been really derailed, I can put, lower, let's say someone moves out of a moldy house. That's a real lowering of a load that could have been contributing to their health. And we give lots of nutritional supports, but maybe something got derailed. Maybe their reflexes were thrown back into more of a primitive state, just like they might with a stroke, right? So then you work with somebody who helps those reflexes move along so that they get brought back up to speed, or helps that joint get realigned, in a way a chiropractor might realign the spine. So there may be some skilled people that I would refer out to, especially in my practice, but also as we would with the Documenting Hope, which is the overarching name for the two studies, because we're documenting everything that we research, that should culminate in a film, documentary, and case reports along the way and that kind of thing. But that it's really, as I see the kind of role of the functional, integrative, holistic type practitioner, it's doing what we know how to do to help the family or the individual lower the barriers to healing, to raise the supports, and then to find, if we aren't the ones that provide that particular technique or tool, someone who we know is skilled at doing that particular piece that we aren't skilled in.
Yeah. I mean, the example of moving out of the moldy house is certainly a good one. Do you have you found other, like in our experience, removing gluten and sugar made a huge difference in terms of overall health and wellness? Do you have things that you have found to make a big difference, or some themes that you have found over the years that you say, hey, if you want to test this, or if you want to try removing this, or anything in the lifestyle, anything in particular?
Yeah, I think there are numerous of those, some of them coming out of the study that we're seeing, that kind of percolate to the top, like antibiotic use, the high amount of antibiotic use. So finding alternatives to antibiotic use when it's possible, or, teaching our doctors to know more about interventions that are effective but don't involve antibiotics for the early stages, so that the infection can't get to the point where we feel compelled to have to use an antibiotic. So minimizing that can matter. I'll give some examples of maybe stories that come to mind. I remember once having a young child, I think they were close to 3, with very limited utterance of anything that was notable as far as, recognizable. And that family was working hard with speech therapy, trying to get the child to say like mom, mom, dada or something, that was tangible. And I know because they set this, they had months, in a few months, it was going to be Mother's Day. Let's hope, shoot for mama, And just by taking an extensive history and learning about that little child's likes and dislikes and propensities and dietary practices, and probably some of the manifestations physically probably had to do with, I'm guessing, I don't remember now, but like ear infections or propensity for that, or maybe some skin things. I felt like this child is likely not doing well with dairy. Now, I don't think dairy is wrong for all people, but for this particular child, there were enough patterns that indicated to me maybe dairy was a problem that I said, let's start there. Let's start with something relatively simply, although he loves his milk. If we can back off from milk, oftentimes you crave that thing that may not be your best friend, right? Whether it be gluten or dairy or soy or something else. And so I said, just give me a call back in a few weeks, and you don't need to come in, but at least give me an update on where you are with that, and then we can, reassess. So I saw them on my schedule, and I was surprised. And the mother said, I know you told me to just give you a call first, but I wanted to show you our child. Sometimes we want to give him a glass of milk to shut him up. Like for that particular child, it was the unleashing of his language, access to language. Now, I wish that it were that easy for every child that isn't speaking, but for that child, it was. So it isn't always a fancy, complex, underlying genetic dysmorphology that's creating the problem. That is, the proverbial straw that's breaking that camel's back. There could have been various straws along the way, but maybe that one, in the context of the other insults, was the thing that body couldn't handle concurrently, or that inflamed it so much or flared things so badly that structurally and functionally that child couldn't act, couldn't function. So I've had, I'll give an example of using kind of an energy mind to determine kind of what might be helpful for a child. So sometimes even putting that kind of product that might be beneficial in the presence of the individual, right? Rather than even consuming it and seeing what happens, but just in the presence of that. And you can do that maybe to more of a degree with, like, say, homeopathics that are pretty much energy anyway, because they're not really substantive. And I had a little guy who had a chronic congenital Lyme and didn't communicate very well, and was kind of walking. I wanted him to just hold something. And it was, in this case, it was they're called gemmos. They're made from the buds of plants. So there is actually some substance, it's kind of like essential oils where you could smell it or whatever, but you could there's actually a little substance in there. But I was using little vials of this, and I had the little guy hold them, and I was just observing him, and his mother was trying to get him to cooperate. And he was walking around the room, rolling his eyes and giggling, and not really paying attention to my request to like hold that, but he was holding it and walking around. And then I held one, which happens to be fig, which is very good for calming the nervous system. And for those of us that are stuck in fight or flight, right, which you could imagine a child with congenital Lyme who was being treated by experts beyond my level of expertise at the time, and making progress on various ways, but also some neurologic challenges still. And that would be calming, that fig might be calming to some system like that. But he had no idea what I was offering, and he just kept wandering around in circles. And then when I handed that particular one, because I had some others in mind as well, he laid down on my clinic table. And I thought, well, that's interesting. The mom said, well, what was that? And I said, I don't know. Why don't you get back up and we'll, let's do some more. So we kept handing him blindly. Everybody's blind to it, except I know there's a pile of them. I handed him that one in the mix of others, but it wasn't until I handed him that one again, he laid on the clinic table in fetal position and looked up at me and said, I love you. Now, that's compelling to me that maybe that would help him. And in fact, it was very helpful to him. So that's kind of the extremes of like as simple as taking away dairy, or as kind of nuanced as letting their energetic body communicate to you because he couldn't verbally do so, to say, this is helpful. There are plenty of examples of people letting go of gluten and experiencing big shifts in their health. Letting go of dairy, letting go of soy, letting go of those foods that are genetically modified such that we can spray them with a chemical that actually causes harm to our own ecosystem. So everybody knows modern times now that we have a biofilm and we have a microbiome. So we have a living, engaged system in our ecosystem, in our mucosa, right? Whether it's your nose or your gut, primarily your gut. And that interfaces with our nervous system and the way our mind works. And so oftentimes it's the things that help heal that microbiome and heal the lining and integrity of the intestinal tract, that we can see often profound shifts in people's bowels, in people's energy level, in people's cognition, even in people's foggy brains being, losing the foggy brain, through dropping those things that are modified for and or sprayed by chemicals. And your listeners are probably savvy on this, and maybe some aren't, but we use chemicals in agriculture, or people use chemicals in agriculture in kind of similar ways to antibiotics. So whether the antibiotic is coming to you via the plant or the food off the shelf, or whether it's coming to you as a prescription, it's coming to you in a way that is having some impact on your microbiome, your ecosystem, and rendering it potentially incapable of playing its role for you. So if you look at the microbiome, and I'm sure you've had probably people on your podcast on this topic, if you look at the ecosystem, we have, as humans, we have 10 to the 13th, say, human cells, roughly. And we have 10 times that number of organisms in our gut, bacteria. Probably 10 times that. So 10 with 13 zeros, human cells, 10 with 14 zeros, bacterium, 10 with 15 zeros probably or more virus that are coexistent and probably have roles in our body, right? And so if we kind of randomly wipe them out with things that are designed to take them out, then we might be taking out with them those jobs that that ecosystem had in your body. So we don't really survive and thrive without that ecosystem. They've done research on animals where they stripped the whole gut lining of any kind of ecosystem, and they lose capacity to do things like make immune cells. One of the important things that people are now aware of is your neurotransmitters, your serotonin, your dopamine, your oxytocin, feel-good ones, right? And then too many or overabundance of maybe the excitatory ones that make us stressed and panic and that kind of thing. Well, that microbiome, that ecosystem, is part of what is it is the manufacturing place for many of those.
I mean, I think it's as high as 90% for many of these, isn't it?
Right. So the gut, is the source of, is most of your immune system, is most of your nervous system. It's a much larger nervous system than the brain and the spinal column. That is the nervous system that is called the enteric nervous system of your gut. So the interface, what is the brain? Where is it? is up for debate. Some people call the gut your second brain. I don't know, maybe it's the first, right? This one just walks around and helps us get into trouble, right? But I'm, joking aside, if that ecosystem is what is interfacing with our immune system, interfacing with our nervous system, is manufacturing B vitamins, fat soluble vitamins like vitamin K, just like it's kind of like, removing half your employees and then still expecting the factory to produce. right? So I don't know if that was a roundabout way of answering your question about like kind of what things do I see change people's health. I see often dramatic things with dietary changes. And that's usually where I start, which is probably because of my passion for nutrition and concern for hunger in the world, which got my attention at a young age. You know, there are a lot of children suffering from hunger in the world, and we have enough to eat. And then I started to learn more about what we were eating. And then I realized we have a lot of hungry children that are well fed, but not well fed, that get plenty to eat, but don't get the nutrition they need. And in fact, get anti-nutrition or things that are actually harming their ability to access the nutrition or the limited nutrition that's there. So nutrition, gut health are always very high on my level of interest. That being said, the spectrum of which you can look at one's health is so diverse. People are familiar with the ACEs or the childhood traumas and how they impact other things. When I was in medical school, I did my thesis in medical school on trauma and comorbidity. So it was actually looking at a large number of cases from a psychiatrist back east who'd collected a lot of data on a lot of patients and looking at kind of psychological and other health issues and what they came to the doctor for, and then their exposure to trauma personally or even witnessing trauma and how that impacted their comorbidities. So that was before the ACEs study, but it's consistent with that. So you cannot disregard trauma as a player in outcomes of health either. And so sometimes those trauma involve relationships that need healing, involve the one's capacity to solve a problem physiologically from a way that they don't have access. Let me reword that a little bit. I'll put it into a slightly different context. If you describe the body, mind, and spirit as having one job, it would be to protect itself. It's stay alive, right? So when we lack the tools for staying alive, the body will then employ whatever it can under the circumstances based on the resources available, based on the example set for it, based on experiences to date. You know, your body with its level of resources and wisdom will try to solve that problem for you at a cellular level, at an emotional level, at a spiritual level. It'll try to fill that void or correct that thing that is putting it at perceived risk.
Yeah, no, that's a good point. Is there anything that you want to make sure that people take away from today? Any place that you want them to go visit, to read, to learn more about health and wellness?
Well, I'll put the plug in for Epidemic Answers because I think it has been 10 years of collecting a library of resources for parents and practitioners to navigate all forms of modern chronic illness and symptomatology and diagnoses, kind of like a checklist of things one could look at for different diagnoses, for example, you know, from ADHD to Alzheimer's, really. And so that can start to give you those insights. We will have that CHIRP survey available for people in the near future. We're switching platforms right now, which is a very laborious task because the platform we had it on shut down is no longer available. It was based on what's called the Living Matrix, that was a functional medicine approach to capturing everybody's not just total load, but chronology, chronologic history. So we will have that available, and you can become part of science and you can learn from that because you'll get a report back about your children. And so we would love and invite people to join in with that. There's no cost of taking it, and you get a report back that can help you think differently or maybe navigate your child's illness differently or think about all the things that might be contributing in the total load. Also, just like I said, there's a library of resources there, though. There are webinars from specialists and you name it, from all different categories over the course of 10 years. And thematically, you can look into things that you might not know a lot about yet, or that might help you kind of in a whole continuum of things you can do that are free to things that you can do that maybe would cost more, like moving out of a moldy house, right? So it doesn't give you the resources to do that, but it gives you the mental resources and also the encouragement that I think most of us need today, and is that we're not alone. So we also have a program called Healing Together for parents navigating difficult situations with their children, where parents can come together in community, in a membership, and discuss that with not only practitioners, but amongst themselves, and share supports and encouragement. Because it's a very lonely journey, as you may have experienced, at least usually at the outset of kind of encountering what your biggest fear of, that maybe something's not working for your child, and maybe not working in a scary big way that sounds so permanent and overwhelming. So we have resources for parents, we have resources for children, and I would say that even though it's child-centric, it would pertain to everybody. When I got into the realm of researching and understanding autism in particular, like trying to navigate what that meant as people were coming to my office for the first time. I didn't learn about that really in medical school. And then got in with the cutting edge individuals that were studying the biology and the biomedical approach. Once I kind of entered that realm, I thought, oh my gosh, this is the model to understand all illness, really. It's like the Petri dish. I'm hard pressed to find anything new that hasn't been kind of looked at in that context for any age or any diagnosis, because there's an overlap. It's looking at that. What is, like you said, the total load? What is it that's the perfect storm today?
Well, good. Well, thank you so much. We really appreciate having you on today.
Thank you for your time.